Welcome to this structured movement therapy session. Today I'm going to take you through some gentle movements which will promote good health and well-being whilst you're confined to bed. This is, however, the second level, and if you haven't completed level 1, I would urge you to do that first. The aim of our session today will be to reduce muscle weakness, to improve your mobility and your flexibility, to improve your circulation, particularly in the lower legs where it's so important. We're also going to be looking at preventing pressure sore areas. These sessions are intended to leave you feeling good whilst taking positive steps to prevent any deterioration. It's really, really true. Use it or lose it. Okay, so Sally's going to be demonstrating our exercises today, and we're going to start with some mobilization to get the joints ready and to get some of our muscles ready for some exercises. We're going to start with the head, gently looking to the right and then to the left. Good. This should be done in a position that's comfortable for you and has been recommended by your healthcare professional. Lovely. We're then going to look at the shoulders. We're going to bring the shoulders up to your ears, roll them back and very gently down. Good. Up, back and down. 2 more of these. Up, back and down. And 1 more. Up, back and down. And rest. Squeezing your elbows now slightly into your waist. We're going to bring the hands to the shoulders, mobilizing through the elbow joint. Lovely. And just 1 more. Good. Bringing the hands gently off the bed. Rotate the wrists in an outward motion. And then change to inwards. And rest here. Well done. Okay, moving to the lower limbs. We're going to gently rotate the ankles in an outward position. Set. 1 more. And inwards. Good. Now a full flexion and extension of the ankles. So extend and flex. During the flexion, we're thinking about the toes being drawn up towards the knees, and extension, pointing the toes as far as you can comfortably. And hold it here. Gently now draw the right knee up towards you and slowly push away. Good, and again, just rotating through the knee and the hip. Brilliant, and just 1 more. Notice here we're trying to keep the ankle and the knee all in line. Changing now to the left leg, slowly up and gently down. And rest there. Brilliant. Okay, we're going to move on to a little bit of a warm-up, just to get us a little bit warm, moving a little bit more, increasing our heart rate gently. And to do this, we're going to use some ball throwing and catching. So I've got a ball here. If this feels a little bit much for you at this time, that's no problem. Think about maybe using a balloon or something that moves just a little bit slower. Or if you don't have any of these facilities, you could use something smaller, like maybe a pair of socks rolled up tightly, or something like that. So sitting comfortably, we're going to gently pass the ball forward and back. This can be quite good fun as well. Excellent, and holding it there. Starting with 30 seconds to a minute, you can gently build up. It's fine for your breathing to gently be increased, as long as it's nice and fluid. Okay, so moving on to a little bit of strength and conditioning. We're going to start with working the quadriceps areas here on the fronts of the thighs. These are big muscles and great for absorption of oxygen. So we're going to place either a small towel gently underneath the knee, or if you have one to hand, you can use a wedge similar to this. Just something to gently raise the knee. So starting now on the right leg, you're going to extend the leg up gently, tensing the muscle at the front of the thigh and gently releasing, keeping it under control. So up and gently down. Now today we're going to start with 5 repetitions, and that's great if you feel like you can manage 5. If you can only manage 1 or 2 at this time, that's absolutely fine. Or indeed, if you feel you can do a little bit more, feel free to work your way up from 10 to 20. That's brilliant. And then gently changing for the other leg. So you can see here the movement is very similar, just slightly longer and gently down. Just ensuring keep control and not banging the heel into the bed. You should feel this, and this should feel just comfortably tied at the top of the thigh. It's brilliant. And just 1 more. Fantastic. And rest. So just remove your support now. Thank you. Okay, we're just going to now just take you back into a slightly more laying position. Okay. If this is not appropriate for you, or you've been advised not to by your healthcare professional, feel free to stay a little more upright. Okay, so we're going to gently now bring the heels towards your bottom. That's it. And we're going to work the hip flexors. The hip flexors run from the hip through to about mid-thigh. We're going to now bring the knee towards your chin. So just gently lifting the foot off the floor, bringing the leg up and gently placing it back down. Good. Just like a little hinged movement. 2. Again, starting with about 5, working your way up. You should feel this right at the very top of your thigh. Yeah. Brilliant. And swap to the other leg. Gently up, slowly down. You can see here, Sally's just using her hands either side just to give her a little bit of support. 4, and just 1 more. 5. And rest here. Fantastic. Okay, moving on a little bit higher, we're going to think about the glutes now, so in the bottom area. We're going to very gently just tilt the pelvis up a little bit, and then gently pushing your weight through your heels here, lift the hips and bottom off the bed, creating a line between the shoulder and knee. Coming up just as far as is comfortable for you, and slowly releasing. Brilliant. So lovely controlled movement, push up and gently down. This is a great exercise if you're trying to move on the bed, or indeed could be really helpful for self and personal care. 3, just 2 more of these. 4. And last one, 5. Fantastic, just rest there. That's brilliant. Good, so turning our attentions now to the inner thigh. If you have a small ball, then great, you can use this, but a towel rolled up will work equally well. You're going to place the ball between the knees, ensuring the feet start a little bit apart, so about hip width apart is great. And then just gently, we're going to squeeze the knees together and gently release. Good, so the knees are coming together and release. Feeling this all through the inner thigh. 2 more. And last one. And rest here. Fantastic, well done. Good. So we try and work both sides of opposing muscles always. So as well as working the inner thigh, we'd like to work the outer thigh a little as well. So if I could ask Sally please to roll onto your side. If this is not okay for you, or you've been advised not to lay on your side, please just gently use the level 1 exercise where we take the legs out straight and then gently bring them back together. That's absolutely fine. If you are comfortable on your side, please make a line with your ankles, hips and shoulders, and then gently lift the knee to about hip height, so we're not going very high, and slowly down. Isolating the muscle here, working through the outer thigh and the tops of the glutes. 3. Just 2 more. 4. And last one. 5. And rest. Gently turn yourself over. This is where these bridges come in really handy. Okay, so once again, the line of ankles, hips and shoulders. We're gently lifting the outside knee, or the top knee, up and gently down.